a little while. There are a couple of things that probably won't change, as transformational as this all is. The first is that we will continue to have a healthcare marketplace in the United States rather than a healthcare system. And I draw that distinction because I think it's an important one. Every other industrialized country has a healthcare system driven in large measure by a central decision-making and authoritative entity in the government, in the national government. We don't have anything quite like that. We have a public-private hybrid marketplace. Today, about 45% public, 55% private. That marketplace's character is going to continue, even with the passage of this comprehensive healthcare reform. The second thing that we do is that our pyramid, our health pyramid, looks and reacts differently than any other country. All countries have a healthcare pyramid where at the base you have good primary care and wellness. We work our way up and become more sophisticated and technological until at the very top we have the most sophisticated and technological applications to health that only you can fully appreciate. Well, every society starts at the base of their pyramid and they work their way up until the money runs out. In the United States, we start at the top of the pyramid and we work our way down. And that character, that appreciation of our technological superiority is something that I don't think will change. A realization that the top of the pyramid is very critical. But I think the real goal is to see whether we can cover the entire pyramid, top to bottom, for the first time, and that in part is what drove this whole debate about healthcare reform. In spite of all the differences that we all fully appreciate, the magnitude of the confrontation in this debate over the last 2 years, there are some things for which there really wasn't a great deal of debate, for which there was fairly general consensus. I would say of all of those areas for which there is that consensus, an appreciation of what the problems are in health are ones that are shared largely by Republicans and Democrats, independents and conservatives and liberals. We have a cost problem. We know that. Last year we spent $8,000 for every man, woman, and child in the country for health care, in taxes, premiums, and out-of-pocket expenses. $8,000 is about 40% more than the second most expensive country. When I was born, health care was 4% of the gross domestic product. When my children were born, it was 8%. When my grandchildren were born, it was 16%, and just last year, the Council of Economic Advisors said if I'm lucky enough to have great-grandchildren, healthcare will be 32% of GDP in the next generation. Well, that's an unsustainable growth rate in costs. When Starbucks spends more on health than they do on coffee, or Ford Motor spends more on health than they do on steel, we've got a cost problem. The second problem that enjoys broad consensus is the fact that we do have an access problem. It's not just those who are uninsured, now estimated to be a little over 50 million, but it's also a question of availability of services given limited insurance coverage oftentimes. 48%, according to many of the research projects that have been done, 48% of all of us have inadequate health coverage to meet all the needs we have with regard to health as our life unfolds. Only 1 out of every 2 prescription drugs today are actually filled. Prescriptions for drugs are filled. So we have access problems that really are very pervasive all through our society, and that was another focus of the effort of policymakers this year and last. The final issue is one that is hard for us as Americans to accept, but we have a quality problem. It's not that we don't have the best research. We do. It's not that we don't have some of the best institutions. We do. Some of the best hospitals, of course. Some of the best doctors. But because of cost and access in particular, we don't always have access to the best. And because we don't have access to the best, and because we've never really applied best practices in healthcare practice across the country, we now rank 19th out of 19 industrialized countries when it comes to preventable outcomes as a result of that inequity and maldistribution. There's also fairly strong consensus about what's causing these problems of cost, access, and quality. Too little transparency. You can't fix what you can't see. And arguably, healthcare is the most opaque, the least transparent of all sectors of our economy. It's the